Hi friends, love and care is a solution for mental health. Welcome to our channel. This is Dr. Amol Pathrikar, consultant psychiatrist. So today we are going to discuss about the anxiety disorder. So what is anxiety disorder? If you feel anxiety means what is that? Anxiety means there is an irrational fear. That means which is unknown. The reason we don't know but we feel fearful. Okay, so this is called as anxiety. So when we feel anxiety, we have a fear and about that dreadful situation. There is a recollection of past events, and those triggers us to feel anxious. Patient may feel having sweating, palpitation, pounding of heart, tremors, and feeling of like breathlessness. These are certain component of anxiety. Okay, so you know what is actually the prevalence and incidence of anxiety? At least 30% of the general population in India is suffering from anxiety disorder. Okay, male, female equally, the ratio is not that different about having anxiety. The reasons for getting anxiety are again the stressful personality, patient having a type A personality or very emotional personality, they tend to get anxiety disorder. Okay, then family history of anything of person, family history means one of the parent is having like anxiety disorder, then genetically it can like landed up in the sibling also the chances of getting anxiety they are more. But then environmental factors, certain things happening in our life, like what is happening, unemployment is there, poverty is there, marital conflict is there, then childhood history of any abuse is there, that gives us like recurrent that bad memories, and then we start with things. There are certain natural calamities which gives rise to post-traumatic stress reaction, like earthquake is there, tsunami is there, any war, and even pandemic. These are the COVID pandemic, for example, which triggers anxiety and gives a sense of insecurity in our life. So this is about anxiety. But there are certain types of anxiety. Okay, so there are certain types mean generalized anxiety disorder, phobias, then post-traumatic stress disorder and panic attacks. Okay, so what is that? Generalized anxiety disorder means I feel restless when a certain unwanted thing happen, or I don't want to take responsibilities, and certain things in our life, like day-to-day life, like when I need to take a gas station, I need to give a like electricity bill. There's certain small things are there. We take stress of that and triggers anxiety. In panic attacks, it is as good as feel like I am getting a chest pain or heart attack. Like patient suddenly, because of certain stress or certain biochemical changes in our brain, the patient start feeling anxious, palpitation, having chest pain, pounding of heart, hyperventilation, and those episodes of these attacks that comes under the category of panic attack. Third number is there are certain phobias. Like phobias mean fear of that particular object and situation. Then we say it is a phobia. Phobias can be like specific phobia or social phobia. Specific phobia like phobia or fear about that particular object. Like many people have that phobia of like needle. Many people have that phobia of like height. Many people have phobia of that animals like dog or snakes. These are certain phobias. Okay. So there is a social phobia also means we always have a thought of like what other people will think about us if we talk on stage or if I talk in public. We always thinks about the other people's judgment towards us, and that gives us insecurity and we don't perform in our like stage. Then we say it is a social phobia. There are post-traumatic stress disorder. What I right now told you, anything happen in the life past which is not like it is not a positive feeling. So something bad happen in life, stressful, dreadful situation, any stress that induce the anxiety when similar situation arise, then we call it as a post-traumatic stress reaction. Many things like when earthquake happen, tsunamis happen, post-pandemic happen, we give that sense of things, insecurity, and that triggers post-traumatic stress disorder. Okay, so these are certain anxiety types of anxiety disorder. What are the management of the disorder? Then how you are going to manage? By counseling, psychotherapy. There are cognitive behavior therapy and rational emotive behavior therapy, which are the type of therapies which are very helpful in treating anxiety disorder. there are certain medications like anti-anxiety medicines are there, antidepressive medications are that really helpful for alleviation of anxiety. Again, you need to do further preventive measures like stress management, breathing exercises, yoga, meditation, which keeps you calm and further prevents to get such kind of anxiety. Okay, so you need to do regular exercises, also physical activity, and keep faith, like talking to the people, form groups, always be take initiative in certain positive things, have keep some gratitude. So these are certain things which will help us to calm down our anxiety. So this is anxiety. Friends, if you like this video, please like it, share it, and subscribe it, and even share it to your family and friends also. Thank you so much.